Good afternoon, esteemed panel of judges, ladies and gentlemen. I am Devanshi Pereira, presenting a qualitative study on healing journey of farmers after snakebite. Snakebite is a neglected tropical disease disproportionately affecting rural, low-income countries, causing significant disabilities. Among tropics, South Asia reports the highest incidence of snakebite. Sri Lanka is one of the highest countries reporting overwhelming in the South Asian region. Anuradhapura district is again one of the regions in the country experiencing highest incidence of snakebite. According to the literature, this epidemiological pattern in Anuradhapura is due to abundance of venomous snakes in dry zone and majority of the population engaging in farming causing habitat overlap. Although we have a free healthcare system available throughout the country, rural barriers lead to delay in accessing healthcare. Most snakebite victims are not followed once they are discharged from the hospital as their acute symptoms are resolved. So, our study aimed to explore the patient's journey after snakebite to understand the challenges and perceptions of snakebite victims and their family members in a farming community in Anuradhapura, Sri Lanka. We conducted an explorative qualitative study including Sinhala-speaking, paddy, chena and dairy farmers aged above 18 years presented to Teaching Hospital Anuradhapura with a snakebite. We conducted consecutive sampling until the data saturation was achieved. Farmers who sustained snakebite during agricultural or related activities and presented to Teaching Hospital Anuradhapura were selected for our study. Semi-structured, in-depth interviews were conducted with snakebite victims and their family members if they were available, using an operational interview guide prepared with referring to a pre-tested questionnaire at the time of discharge, and they were followed up for 6 weeks via telephone conversations. Each interview was conducted for 30 to 40 minutes. These were recorded, transcribed, translated to English, and were analyzed thematically. So, analyzing the sample characteristics, our sample consisted a total of 14 snakebite victims, out of which 12 were males. The median age range was 54.5 years. When considering the occupational distribution, there are 5 were paddy farmers, 5 chena farmers, and the rest were animal husbandry. 4 farmers had confirmed russet violet lights. 9 patients were transferred to Teaching Hospital Anuradhapura from peripheral hospitals. It had took 30 minutes of a median time to reach a hospital from the bite site. None of the patients had sought coordinated treatment before hospital admission. Our data set comprised of a total interview transcripts of 67 interview transcripts from snakebite victims and 14 from immediate family members. Six key themes emerged from the thematic analysis: profound confidence in allopathic treatment during acute phase, challenges when accessing treatment, overall satisfaction with acute care, post-discharge reliance on native practitioners, strong family and community support in mitigating the social impact, and understanding that snakebite is inevitable adversity. Profound trust in allopathic medicine. Patients believe that government hospitals were well equipped to provide critical care for snakebite victims. This belief was reinforced by hospital trust outcomes, either personal or as someone known to them, urgency of the situation, and the contextual factors such as time and place of bite. Perceived limitations of traditional medicine, including the lack of prepared medication to manage emergencies. Challenges faced by snakebite victims in seeking treatment from hospital were reported by the unfamiliarity with the environment at the bite site, lack of immediate access to communication devices, family-related considerations influencing treatment-seeking behavior, and limited availability of the emergency transport. General satisfaction about care during the acute phase. Many patients express satisfaction with the care they received at both local and Teaching Hospital Anuradhapura. They describe receiving prompt recognition, prioritization, and continuous care from emergency department through the worldwide stay. However, one patient reported delay in diagnosis, which had led to prolonged hospital stay of more than 2 weeks. He emphasized the significant impact this had not only on his own well-being but also on his family. Post-discharge reliance on native practitioners. It was evident that majority of the patients relied on native practitioners following the hospital discharge. This reliance was largely influenced by pre-existing cultural beliefs and suggestions from visiting family members or friends. Many patients strongly believe in the concept of complete venom removal as an essential to prevent long-term complications. Additionally, they cited a needs access of medical practitioners to their communities as a contributory factor to this practice. Strong family and community support in mitigating the social impact. Although most snakebite victims were from rural areas, they reported to receiving considerable support from both extended family members and their local communities during this recovery period. This collective assistance played a significant role in mitigating the social impact of the snakebite. Finally, moving on to understanding snakebite is inevitable in their setting. The families acknowledged that snakebite were an inevitable risk in their occupational and environmental setting. As a result, they emphasized the need for proactive adaptation and preventive strategies to reduce the risk of future snakebites. Last but not least, I would like to acknowledge the limitations that we had in our study. One notable limitation was the selection bias, as our study recruited participants from the teaching hospital Anuradhapura. As such, the findings may not fully represent the experience of those who did not seek hospital-based care and were treated in peripheral hospital settings. However, we believe that the participants included in our study were able to provide rich and in-depth insights that are highly relevant to the context of these snakebite victims. So, in conclusion, in Anuradhapura, families strongly trust allopathic medicine for acute life-threatening effects of snakebites, but eventually seek native treatment for persisting minor illness and for reassurance, which reduces the burden on hospitals. Thank you so much for listening.
Great. A very comprehensive